Hello, my name's Evelyn Hastings, and I'm going to be speaking to you about autism spectrum disorder, which is also called ASD. My instructor is Dr. Jeremy Colvin, and the due date is July 26, 2026. Autism is a developmental disability that affects how a person communicates, interacts, and behaves. There are many different levels of autism. That's why it's on a spectrum disorder. This is what what is autism? Autism is a developmental disability, and it's a way the brain works and develops. It affects how it works and develops. Children on the autism spectrum may communicate differently, have trouble with socialization, and show repetitive behaviors. Autism is usually diagnosed before the age of 3. And every child experiences autism differently. No child is the same that has autism. Some children with autism need a lot of support, and others can live independently. Signs and symptoms of autism. Children who have autism show signs early in life. They may not respond to their name. They may avoid eye contact and have delays in learning to speak. Social situations may be difficult because they have trouble understanding others' emotions, facial expressions. Because of this, some children with autism prefer to play alone. They may play side by side, but they'll play alone. Not every child will have the same symptoms. They can vary in severity. Behavioral characteristics. Routines are so important with children with autism. If your routine as someone with autism changes even the slightest, it can throw your day off completely, and just the day will go wrong. It can take a short time also, but most of the time it just messes with their day and makes them feel bad the rest of the day. Repetitive movements such as stems, snapping, flapping their hands, clicking, pounding their chest. Those are a lot of stems that people with autism do to help calm themselves. Children with autism can also be sensitive to sounds and noises. So a lot of children with autism wear headphones or earbuds, or to drown out the sounds of everyday life. How autism is diagnosed. Through their pediatrician, you will go and have your wellness checks that a child will be hitting milestones. And if they are not meeting these milestones, doctors will do screenings for autism, and they can give parents a form to fill out to where you judge how they're interacting throughout their life and how they're growing. And it can also go to their teachers, and that way they can try to figure out what's going on with your child and if they have autism. What they're looking for is motor development, fine motor skills such as writing, dressing, and even walking. Sometimes those things can be difficult for a child with autism. And you also have what's the word I'm looking for? Fine motor development. They will have parents, caregivers, and teachers fill out the questionnaire and see how they're doing developmentally and socially. This is the one I was getting to, trying to remember. Autism mainly affects communication and behavior, but many experience motor development delays. Fine motor skills, like I said, such as writing, using scissors, buttoning clothes could be difficult. Coordination can be difficult with children with autism. Gross motor skills such as like throwing a ball, jumping, even walking can be affected on children with autism. Treatment and therapies. Autism has no cure. Early intervention is the best possible outcome for a child with autism. This way they can help improve their communication, how they're learning, and teach them to learn to play with other children, and do daily living skills on their own. Speech therapy can also help get with communication. There is communication devices that they can tap on and tell you what they want. Also, how if they are talking, maybe speech therapy can teach them how to say words correctly, or even sign language. Occupational therapy helps with everyday living skills, such as walking, dressing, and playing with others. And then physical therapy helps with coordination and movement, balance, and helps build those muscles and bones, and to help make them stronger. Educational peers will also help with reading and writing and getting them support in school. So there's also therapies in school that will help them. Living with autism. When you live with someone with autism, it is very important that you are patient, super patient with them, and communicate as clearly as possible. Give command directions if needed. Use routines. Always keep your routines as much as possible. Things change, and yes, you're going to upset them, but make sure you keep those routines as much as possible. Encourage them to communicate as much as possible. If they don't tend to communicate and are not clearly communicating, so it's important that you teach them those skills. Always celebrate when they do something amazing. If they dress themselves and it's been a difficult time with them, celebrate. If they tell you what they want and it's something they haven't done, or it's something starting to be consistent, celebrate those milestones. Always work with teachers and therapists. They are there to help you and guide you through the autism world. Interesting facts of autism. 1 in 31 children in the USA has autism. Boys are diagnosed more often than girls. Earlier diagnosis leads to earlier treatment. Like I said, if you can get those treatments in early, and the sooner we can help them, the better, and grow those muscles in their brain and teach them how to be independent. And then many people with autism have amazing, unique talents that I've seen people with autism just thrive with, like they love dinosaurs, and so they know everything about dinosaurs, or Transformers and how much they love Transformers, and they bring into our lives, and or they learn how to cook, or they are very smart. I have somebody super special to introduce to you. This is my son Austin, and he is currently with me right now. This is Austin.
Hello.
And he has autism. Show him your Transformer, Austin.
My childhood one, but I've had it since I was like 1 year old, almost 1 year old.
Yep.
Almost.
So I have lived through the diagnosis of autism, and we've had to grow up together. We've had battles, we've had happy moments, and we have thrived. I'm super proud of my son Austin and all the accomplishments. He used to be nonverbal, and because we were able to get him diagnosed at a young age, we were able to get him in therapies, and now he has a full-time job working at Domino's, and he is the dough expert. Is that what it's called? Yeah, he's a dough expert. So I'm super proud of him. He's able to bring his own money in, and I couldn't be prouder of him. Thank you so much. And there's my references.